What if our greatest threats aren't new, but ancient, hidden beneath the ice, waiting to awaken? For millennia, glaciers and permafrost have preserved remnants of prehistoric life, including bacteria and viruses from a world before humans. But as the planet warms, this colossal freezer is failing. The ice is melting, and with it, ancient microorganisms, dormant, not dead, are being released. These are not myths, they are real, preserved pathogens, time travelers from a vanished world. The permafrost is a frozen graveyard, holding not just mammoths and ancient plants but invisible life forms, viruses and bacteria that once thrived in lost ecosystems. Now, as the thermal barrier dissolves, their world collides with ours. The question is not if, but when these ancient microbes will re-emerge, and what will happen when they do. We stand on the edge of a biological frontier, facing threats our medicine and science have never seen. The rapid melting of the world's cryosphere is a present-day crisis, not a distant worry. Permafrost, covering nearly a quarter of the northern hemisphere, is thawing, unlocking a biological time capsule. As it melts, preserved organic material decomposes, releasing greenhouse gases and ancient microbes. Scientists have revived bacteria and viruses dormant since the Pleistocene, proving these organisms can survive for millennia. Each thawed patch of permafrost could release billions of microbial cells, introducing unknown variables into our environment. These microbes are not fossils, they're viable, ready to metabolize and replicate. The scale is staggering, millions of square kilometers all thawing at once. The release of these organisms is an uncontrolled experiment, with unpredictable consequences for ecosystems and public health. The thawing permafrost is not just a climate issue, it's a looming biological crisis. In 2016, the threat became real in Siberia's Yamal Peninsula. A heatwave thawed permafrost, exposing a reindeer carcass infected with anthrax decades earlier. The revived spores spread through water and soil, infecting reindeer and people, killing a child and thousands of animals. The Russian government scrambled to contain the outbreak, deploying military bio-units and quarantining the region. This was no isolated accident, it was a warning. Anthrax is a known enemy, with treatments and vaccines, yet the outbreak was devastating. What if the next pathogen is unknown, with no immunity or cure? The Arctic's permafrost holds countless animal carcasses and even human graves from past epidemics. As the ice melts, the risk of ancient diseases re-emerging grows. The Siberian outbreak was just the first alarm in a much larger, ongoing crisis. Reviving ancient organisms isn't just theory, scientists have done it. In 2014, researchers revived Pythovirus sibericum, a giant virus frozen for 30,000 years. It only infects amoebas, but its revival proved that complex viruses can survive and become infectious after millennia. More giant viruses have since been found, suggesting the permafrost is full of ancient viable viruses. These lab experiments are tightly controlled, but nature's thaw is not. Scientists study these viruses to understand their risks, sequencing genomes and searching for dangerous traits. Each revival is a reminder, the melting ice is a Pandora's box, and we're only beginning to glimpse what's inside. The real danger is not just sea level rise, but a microbiological event on a global scale. Most ancient viruses remain unknown, locked in the ice, waiting. Climate change is slowly lifting the lid. The greatest danger of ancient viruses is our total lack of immunity. Our immune systems learn from exposure, but a virus absent for 50,000 years would be utterly new to humanity. A pathogen mild in ancient times could be catastrophic today, spreading rapidly through our dense, connected world. Modern medicine would be at a disadvantage, developing treatments and vaccines from scratch, with no prior knowledge. The time lag could allow a pandemic to spread unchecked. Ancient viruses haven't co-evolved with us. Their effects would be unpredictable, possibly harmless, possibly devastating. The strangeness of these pathogens could make them more dangerous than anything we've faced. We simply don't know what to expect. The uncertainty is terrifying. A threat not just new but alien. We may be facing relics from a world to which we no longer belong. Once released, ancient pathogens have many routes to reach us. Melting ice releases microbes into water, which flows into rivers and oceans, used by people for drinking and fishing. Wildlife, migratory birds, caribou, marine mammals can become infected and carry pathogens across continents. Birds alone could spread a virus globally in weeks. Ancient viruses may also evolve rapidly, mixing with modern microbes to create unpredictable hybrids. Human activity in the Arctic, mining, drilling, shipping, brings more people into contact with thawing permafrost. A single exposed worker could carry a virus to a distant city before symptoms appear. Our interconnected world is primed for rapid disease spread. The infrastructure for a pandemic is already in place. All it takes is a spark. COVID-19 showed how a novel virus can upend the world, even with modern science and surveillance. That was a known unknown. An ancient virus from the ice would be an unknown unknown, with alien genetics and unpredictable effects. Developing treatments for such a pathogen could take far longer, with no guarantee of success. Scientists are racing to monitor the Arctic, sampling ice and soil, sequencing DNA, and building a library of potential threats. But the Arctic is vast, and our resources are limited. The release of ancient viruses is tied to the broader crisis of climate change. The same forces melting the permafrost are driving habitat loss and increasing zoonotic risks worldwide. The threat from the ice is a symptom of our planet's failing health. The ice has kept its secrets for millennia, but its silence is breaking. Are we truly ready for what might emerge from the thaw?